Johnny Davis alive. Hope everybody's doing great out there, having a good time while protecting yourself and being safe, right? Wearing those masks, all of that other good stuff. And look, guys, we got a great show for you today. So more of a serious show, but you know me, Johnny Davis Live, real talk, real solutions. We're going to really get into it today with our fight doctor, Dr. John Lucas. Again, I've always, I've had him on the show now for a long time, many years, seems like years. And we started a segment last year around this same time about, fight talk, doctor talk. And he's just so informative, so much information. And I think you guys will enjoy hearing what he has to say in regards to COVID-19. We got to talk about that a little bit more. Hopefully we're at the end of it, but we obviously have some things that are going on right now that we need to pay close attention to. What are we doing right? What are we doing wrong? Or what could we do better? We're going to talk about everything today, guys. I want you to fasten your seatbelts. We're going to really get into some of the deep-seated questions that I think people need to be asking. And this is, again, we know we're getting good information from this doc. He's straightforward. He tells it like it is and everything. And look, you can take this advice. Hopefully you will use it if it's useful for you and you feel like it's something you can do. And if not, hey, pass it on, all right? Or don't, all right? And go from there. Hey, look, as always, we want to thank our sponsors, wearwig.club at wearwig.club for all they do for us, and Eastern Offset Printing for all they do. Be sure that you can also like us on our Facebook page at AK Promotions. And also we are streaming live now, right, on YouTube right now. So welcome all the YouTube people out there as we're trying to grow that format out there. We're not really there yet, but we're certainly working on it. So hopefully we will, if those of you who maybe not have Facebook, you can tell people, hey, you can also see it on YouTube. So be sure to check that out as well. Just want to remind everyone, as you know, the IKF Georgia Classic is coming up, guys. It's going to be a great event there in Georgia, in Columbus, Georgia, at the Columbus, Georgia Convention Center. It's going to be an exciting event, January 2nd and 3rd. Registration is going on right now. You need to get registered, guys. Men, women, and juniors will be fighting for some championship belts. We filled up yet another bracket this morning. So we only have 4 people that can fight in a bracket. So go ahead and get in right now. Register at akpromotions.org. We're going to keep the price the same until like December 20th, right? And then after that, things will start changing. Obviously, we're on a few days before the actual tournament. But if you're not in by then, shame on you. Go ahead and try to get in by December 13th. The other day, I did a little segment, and obviously, guys, I'm not a doctor, right? Of course, I don't think I need to tell you that. But, I have my advice and my advisors, and Dr. Lucas is, of course, one of those, and some other people that I speak with. But the other day, while I was, just kind of thinking about how I wanted to address this more directly and how I feel about the COVID-19. So what I did was I took a little segment before we go to our guest today, and I'm going to ask him about that because, again, he is the doctor, not me, right? And I'm going to ask him about, what he felt about these comments. So take a listen for those of you who did not hear what I said about the COVID the other day. I want you to take a moment and listen to what I said, and then we're going to ask the doctor about that. But we have a whole list of stuff we're going to be talking about probably for the next hour. Okay, so lock in, guys, and hopefully you will chime in with your questions. If you have questions or comments, we invite you to please ask those questions and make those comments here live today. But let's listen into what I said the other day.
Is I respect the COVID. Now, I know that might sound crazy. Why would you respect the COVID? Well, I do. I respect the COVID. I respect the COVID because it is real. It has taken out a lot of people, right? And so when, like in a fight, if you have an opponent that you don't respect, you get knocked out, right? So the COVID is real. It exists. And this is why I think it's important for all of us to respect it, get educated about it, and see what we can do to move forward. The thing about COVID-19, and I'm going to call it what it is, COVID is a bully. COVID-19 is a bully. And what I mean by that, COVID attacks the weak. Those that might have those underlying medical conditions, those who might be more frail. We get it, right? And we certainly don't want our precious seniors and those even with underlying medical conditions, whether it's their fault or not, to be taken out by the COVID. So we got to respect the COVID and what it can do. And we also at the same time have to be responsible to protect those that are more vulnerable, whether it's on their accord or not. And what I mean by that is being healthy and working out and protecting yourself from certain things, keeping your body as healthy as possible, eating right, and all those things is a big defender against the COVID. So getting in shape, right, working out. Even if you caught the COVID, for the most part, it would, in most cases, not take you out, right? So we recommend that you get in shape, that you work out, that you eat right, right? So that when COVID comes along, so that is a responsibility on every individual that can work out, right? Those people that can be more responsible, that can eat right, to build up their immune system to fight COVID. And that's my big argument about why gyms should not be closed down, right? For obvious reasons.
All right, there you go, guys. So I wanted to just just kind of remind people of the kind of what I said the other day, perhaps putting my foot in my mouth. Ladies and gentlemen, let's get the real advice now from none other than Dr. John Lucas. How are you, sir?
Good. How are you doing, Johnny?
Good. Thanks so much for being on today. I really appreciate, you taking the time to educate our audience and those out there who check out our show here on Johnny Davis Live. But again, I always like to explain to people how important you have been to my entire process and my company and my organization. And so I wanted to bring you on to, get that advice. Like I said, you're like a sage to us. You give us that good advice and you're honest about what you have to say. And again, these are very kind of politically fueled times where people have all these ideas. You seem to go right in the middle and say, this is what I think and all. And so that is what I'm looking forward to people hearing more about from you today. But first of all, on my little comments that I made there on my little thing there, what did you think about that?
No, I think they were pretty much right on the money. When I saw that the first time when you posted it, if I had a significant disagreement, you would have heard from me.
Right.
I would certainly have given you a holler about that. But I mean, I think what you said is exactly right. So, I think that as a society, we have a responsibility to try to protect those of us that are most vulnerable. And I think as individuals in that society, we have a responsibility to the best of our abilities to try to mitigate our susceptibility to this disease and really to a lot of other diseases too, by doing the same things, trying to use this as a reason to eat a little bit better, use it as a reason to get in shape if you're not in shape, or stay in shape if you are in shape, right, and things like that. And we've talked a number of times before. I can't remember who was on here privately about the gyms being closed, and you know how I feel about that. I think that is an unfortunate consequence, because the people who are typically using gyms are at a statistically very low risk for significant complications from COVID. And with some relatively easy modifications, you can substantially mitigate the risk that people incur by going to a gym. Just like what we've done at your PKBs and the East Coast Classic.
Right.
You've had how many of those events now during this, and we've not had any problems.
390 fights since July.
Yeah, and there's been zero problems that I'm aware of.
None.
It seems, depending on how you look at it, you've either done a ton, because you had to make a lot of changes to make it happen.
Yes.
But when you come right down to it, it's what you're doing is not hard. There's no reason why other people couldn't do the same thing. There's no reason why other people couldn't hold events or use a similar process in their gym to stay open, keep the money coming into their family so they can feed their family, and just as importantly, continue offering their services to the community. And then other people, especially since we're lucky and live in South Carolina where it's relatively nice out most of the time, I've seen a number of gyms in the area start doing things like moving their classes, a lot of their fitness classes, outside and doing stuff outside. They can do some more spacing and There's a yoga studio around the corner from where I live that's done that. You see them out in the parking lot with their yoga mats doing yoga out there when it's nice out, which is most of the time. And, little things like that make it makes the risk of participating in those activities less and less and less.
And I do want to ask you about, can I ask you just to pull your camera down just a little bit so that you can go higher up on the top of the screen?
Sure. Hang on.
Just a little bit so that we can, I want to get your head closer to the top there, because when I put those things down there, it just makes it, right there. Perfect.
There you go.
Right. Okay, good. Thank you so much, Doc.
No problem.
Yeah, and sometimes, I have kind of questions about that part too. But let me ask you about South Carolina, because I was listening to Governor McMaster the other day, and I don't care about whether you're Democrat, Republican. I don't give a crap. I like common sense is what I like, right? But I am curious about the response and everything that the way they've handled it. He's very vocal about the fact that the way they've handled it financially, at least, it seems that it has worked because the industry has been open a lot longer. They didn't do a long time shutdown. So therefore, the unemployment rate is down. Financially, they seem to be, I don't know quite what the COVID numbers are. And we'll get into that in just a second as far as what we should be looking at. But how has South Carolina done in this thing? Are the hospitals now filling up, or what is the, just give me an idea of what's going on.
A very timely question, because just before I came on to talk with you, I was actually in our medical director's meeting with the hospital where we talk about for our system. So the hospital system I work for is now by far the largest hospital system in South Carolina. It extends from the Midlands all the way up through into the North Carolina and Georgia borders. And then I'm in close contact with MUSC, which is the hospital down in Charleston, because we send patients there quite a bit. So we, at this exact point in time, the COVID numbers across the state are still pretty significantly below where they were in July, August, when South Carolina reached what was at that time the peak. The downside to that is our numbers are increasing, and they're increasing pretty fast right now, but it remains to be seen what's going to happen with that, whether that's going to continue. A number of the hospital administrators and our infectious disease folks are real concerned about the next 10 to 14 days as we find out, as people traveled around the country and flew and got together with their families and things like that, is that going to cause a huge spike here in South Carolina, or is it not? Personally, I'm not only hoping for is it not, but I think that we're probably going to be okay from a Thanksgiving standpoint, largely because since we're a relatively small state and relatively rural, most of the family gatherings throughout the state are with relatively small families and people that are kind of in contact with each other. Anyways, there's not quite as much of people flying from, California, Texas, New York, and whatnot to get together for a huge Thanksgiving dinner across the state as there would be in a metropolitan area where you've got huge groups of people that are all commingling. And even if you do have a big group of people, if you live in Dillon or someplace like that on a bunch of property, hypothetically, and had your family come in, you're probably well over 6 feet away from your neighbors. You live on a couple of acres of land, and you're only interacting with other people that are directly in your family. Where in some of the bigger cities, as your family's getting to you, they're walking through the same door with 400 other families that are using the same door, the same elevator to get up to the apartments and big buildings and stuff like that. So South Carolina, because of the fact that it's a relatively rural state, is probably uniquely or somewhat uniquely positioned to have a little bit less impact from huge spikes in the virus than some places. I'm from New York originally, not the city, but I have some friends that are doctors in New York City. And, when they went through their huge spike at the beginning, it dawned on me that there's more people that live in Manhattan than there is in the entire state of South Carolina. So, you've got a huge population of people that are all shoved together in a really small area. So, I'm sure you've visited New York City. You get off the airplane, and within 5 minutes, I've walked past more people than I would in a month here in
exactly.
or Simpsonville.
Right. So it's just a totally different type of atmosphere and everything. But overall, South Carolina seem to be doing pretty good.
Yeah, at the moment we're doing pretty good. And we'll probably talk about the vaccine later, but the vaccine's coming. Like I would expect that here in the upstate, our hospital system is probably going to start offering the vaccine to healthcare workers as early as next week. And then I keep wanting to say Moderna, but Moderna, whatever the other company is that's about to get approved, is only a couple of weeks away. So that's going to help. That should help a lot, because if we can get our healthcare workers and our highest risk people that are willing to take the vaccine vaccinated, that's going to give us an increasingly large chunk of the population.
Right.
It's not going to be needing hospitalization or ICU beds and things like that.
Right. Well, I certainly want to talk about vaccines and everything, because I think that is something that's definitely down the road, and I know people are pretty excited about it. But I want to just digress just for a moment here, because we talked about the fact that I've been doing events, and I just kind of want to put that out there. And since July, and again, it's with great caution. It's with the temperature checks, mandatory mask, and things like that. And we haven't had any incidents. We are doing that serious hand sanitation, which every time you come in, you have to sanitize every time without exception. I did it 20 times, probably 20, 30, 40 times at every tournament that we do. Is the fact that I'm not getting reports on anyone doesn't necessarily mean that we're not spreading it, but it has to be really reducing the chances of it spreading at our events and doing those type of protocols. I mean, why would you think I've not heard anything about it? I mean, there's probably a lot of reasons.
Yeah, so I think that's exactly right. There's probably a lot of reasons. So first off, the protocols that you're doing, you're basically following all of the CDC, WHO guidelines that you possibly could in that sort of environment. I mean, it is not just the sanitation, but the steps you took to keep people socially distanced. Like you walk into the locker room, the locker rooms this time were way bigger than they were before, because you moved venues, and you had a group of guys from, Jeff Grady's gym, and then 10 feet away, there's a group of guys from,
familiar people that were familiar.
Yeah. Right. So by doing that, even the people who were together anyways, there was a lot less just random intermingling, and then spacing the seats out in the audience made a big difference as well, because distance is your friend. The fewer people who you're in close contact with, and they sort of define close contact as within 6 feet for a prolonged period of time, the fewer people that meet that criteria, the less likely you are to contract the potential exposure. And then adding into that the hand sanitation, which makes it more likely that people aren't, I should say that the other way. It makes it less likely people are spreading it by touching stuff with dirty hands, or if they do touch something, when they leave and they come back, they sanitize their hands again, they're good to go. And then having the mask on, if somebody were to be infected and not know it, it reduces the amount of seeding in the environment they do as they're walking around, because their cough, their sneeze, their breathing and whatnot, they're not spraying out an aerosol that has coronavirus on it the whole time. So all those things should, and I would argue, have made a big difference. And then the other thing is the population you have there. I mean, who's at most of your kickboxing events? Relatively young people who go to gyms, they work out, they're in good shape, they're serious about their diet. So they're probably, as a comparison to the population, drastically lower risk for serious infections. And then largely, especially the younger folks, asymptomatic infection is very common in younger folks. They may get it and never know it. So it's entirely possible somebody's had it. We just didn't know. But you shouldn't care, or at least you shouldn't care a lot about something that you're not having symptoms from, as long as you're not then exposing it to your grandma, PD and that kind of stuff. But I think that the protocols that you've put in place certainly would have substantially mitigated the risk. And other sports have done the same thing. I told you my son's playing in the South Carolina state championship for his football. And I didn't think that the high school football was going to happen in South Carolina, but the South Carolina Football League put some protocols in place. They make people wear masks when they're at the stadium. They reduced the number of people who can go and space people out. So, I go to the game, and it's a little weird going to a football game with 500 people in these huge bleachers when there'd normally be 3,000 or 4,000. But I am not aware of anybody that's complained about it. When you look at who's there, there's some people who are older, but they're people like my parents who are in their 70s, but they're in good shape. And they've made the choice. They're like, I would rather take the potential risk of maybe getting this infection that's probably not going to be a big deal for me, for somebody who's in good shape and doesn't have a lot of risk factors, to see my grandson play high school football than to not. But somebody, if my parents were lifelong smokers and overweight, not in good health, they wouldn't be there.
Right. And and again, it goes back to being responsible. But I'm in total agreement. I mean, I really think I know people, California, for example, and I have a lot of stuff going on in California. Listen, and it's not about politics. It's that, I just think I just think we have it wrong. And I say this on Facebook, where I know I'll get, hundreds and thousands of views and stuff. But this is where I believe, it's not even political. It's just, to me, just shutting down and running from it, if you will, and not learning to live with it is, to me, the wrong direction. Now that I know better, I just think that I've been out here, quote unquote, you are a real frontline person, but I am a frontline person when it comes to sports, right? And I'm right there in the middle of it. I'm right there with people. And my referees are right there in the middle and stuff. And so we are frontline when it comes to the sports industry. And I now have enough data to say that, listen, we've done this successfully. So that's the part that kind of gets me, why I don't know who's advising these governors, right, of shutting down everything. Right? And we need to learn to move forward. Yes.
So it's, people complain about doctors in particular, historically, not just about COVID, but sort of forever, about being overly conservative. I don't mean politically conservative. I mean conservative with their advice. If you're playing football and you twist your knee and you go to an orthopedic surgeon and say, what should I do? They're probably going to tell you, well, don't play football anymore, because you're going to continue to get hurt. And certainly if you were to go to a neurologist and say, hey, I want to do this kickboxing tournament, what do you think? They're going to say, well, you mean you want to intentionally let people try to kick you and punch you in the head? Don't do that. And medically, that may be the best advice for that specific organ system. We struggle as physicians in American medicine as a whole of looking at society and looking at people, because I'm sure some guys that you went to high school with, and you may have been one of them, that if it wasn't for competitive sports, there's no way they would have gotten through high school. Right. I have a couple of really good friends in that. So, and really, my son might fit in that same category. He probably get through, but football has been the best thing in the world for him. It's totally changed his motivation, and it's going to make him a much better adult, and therefore greatly benefit society. But the downside to that is there's a risk that he could tomorrow, someone could fall on his knee wrong. He's going to blow out his knee. Yes. That wouldn't be cool, but that's not a life-threatening thing. And the same thing with head injuries. Right. As long as you do things to mitigate the risk, like if somebody gets in a fight and you think they have a concussion, you don't let them fight again for, a certain period of time until they've recovered from it. There's things you can do to mitigate that risk. So to jump to COVID, is it true that if everybody could somehow hold up completely isolated, like in their own room for a couple of weeks, could we completely eradicate COVID? Almost certainly. But at what cost? That's just not a realistic thing. There's, mental problems for people that need exposures. There's obviously massive economic issues with that. So you need to have somebody who can take the 10,000-foot view and listen to physicians about, this is what we could do, the best possible thing to completely eradicate this, and listen to the business owners that are like, okay, yeah, that'd be great, but it's not going to be good for me if COVID goes away, but now I'm literally starving because I can't feed my family, or this and other thing, or this person commits suicide because they can't talk to their. You've got to find a way to balance that, and that's what politicians, I think, should do. And that's what's been, I think, most horrifying to me about this whole thing.
What I think politicians need to do? They need to call Dr. John Lucas. That is what they need to do, because I really think you have a good handle on this thing. And again, the numbers and things like that we are seeing is always interesting. And again, and I know that people, if you look at, David Muir on the 6 o'clock news or 6:30, it's like the numbers, and you look at all this on these different channels and things, and you see all of these about these numbers growing. I don't know if the reporting is exactly the way to gauge this thing, but let me go a little bit more in depth on that. What is the benefit in a hospital, right, reporting a COVID issue or COVID a patient compared to somebody with just the flu or the common cold?
Yeah. So, that's when you read Facebook conspiracy theories, that's one of the more popular ones.
Right.
One of the reasons why numbers are so high is because either people who are getting admitted with COVID are being intentionally overtreated and put on ventilators because there's more money associated with that, or that massive numbers of people that don't have COVID at all are being told they have COVID because there's a financial benefit to the hospital.
Right.
And like any good conspiracy theory, there's a hint of truth to that.
Yeah.
Because if there wasn't, it would be easy to disprove. So it's a fact that as part of, and it might not be the CARES Act, but there was an act that was passed relatively early on in the coronavirus pandemic to try to protect hospitals from taking massive financial losses from uninsured patients having this. Because what you don't want as a society, and that's one of the crazy things about the American medical system, is that we have such a large population of people with no insurance whatsoever. You don't want somebody that's working a minimum wage job where they're exposed to tons of people, so like retail, fast food, something like that, to know they're sick and have a fever and feel bad and have COVID and then go to work and give it to 500 or 600 other people because they can't afford to get treatment. So to try to mitigate that risk, the government did something that was actually smart for once and put in some measures to provide payment for those people. But the downside to that is it's definitely true that hospitals get paid a fairly good amount of money for a patient that's hospitalized and identified as having COVID. And then in addition to that, if that COVID patient is on a ventilator, that was selected, unfortunately, probably inappropriately, but it's the best they could do at the time, as a marker of severity of disease that would justify a higher payment. So what classifies calling somebody a COVID patient varies. So in some states, and I think being the important part of this phrase, I think in South Carolina, you actually have to have a positive COVID test to meet the criteria to use those billing codes and get the reimbursement for that. But other states, and I'm almost certain New York is one of these, a presumptive diagnosis of COVID can do it. And again, that was put in place back when testing was scant, where now getting a COVID test is relatively straightforward because there's plenty of it available. So it's entirely possible that, and I'm not going to say doctors, because the individual physician would in most cases have no direct financial benefit to misclassifying somebody who doesn't have COVID as having COVID. But hospitals, particularly private hospitals, the administrative level would have a direct benefit for doing that. And they could potentially say, hey, we want to make sure that anybody who could possibly have COVID gets coded as that. The protection from that, and the reason why I don't think that that's a huge problem, is that you're probably aware of the whistleblower protections and stuff that exist. So there's thousands of people that work in these hospitals, and if any one of them had any sort of decent proof that that was going on, they'd stand to make millions of dollars because they would get paid 3 times whatever the hospital profited by engaging in that fraud. Because, I mean, that's demonstrable fraud. If they're falsely classifying somebody with a disease they don't have, then that would just be rank fraud. And the fact that we haven't seen that happen makes me suspect it's not a huge problem. And then, even with testing, tests are not perfect. There's false positives, there's false negatives. So there's for sure, you see things on Facebook about, my father-in-law had a heart attack, went to the hospital, and he had COVID on his diagnosis. Well, there's a couple of potentials for that. A very likely potential is that he had a heart attack and also had COVID and got tested by EMS as he was going, and it came back positive, and you're just not close enough to him to have seen his medical record to see that happened. And in some cases, it's entirely possible that there was an error. You've also seen, I'm sure, people that say that they went to get a test and decided the line was too long and left, and then 2 or 3 days later got a phone call saying that everybody who was in their car was COVID positive. I find that very hard to believe. And it's interesting that every time I've seen one of those reports on Facebook, it's the exact same scenario, but the names have changed. And it's never it happened to me, it's always my uncle's stepsister's daughter-in-law.
Right.
Thing. So, that may have happened once. It's entirely possible that there's a computer error or a person error where they signed in, Johnny Davis came at such and such a time, and then you left out a line. So the next person behind you, their test got tagged with you. Accidents happen. Physicians and nurses are not perfect.
Right.
But again, I highly doubt that that's a real common problem.
Well, it's interesting that you bring, because there's so many scenarios, and then we're going to get into that media thing. Again, guys, you're watching Johnny Davis Live here with Dr. John Lucas talking about the COVID-19. We got a lot to talk about here today, guys. So, as I said, buckle in there. I'm going to try to keep him, if I can keep him on. That's the whole idea. One of the other things that I noticed too about, as I talk to people and I see people, and people have said sometimes that they know somebody that had COVID, or they might have COVID, or the situation. But it's embarrassing, kind of, isn't it? Do you think people kind of, see it as some level of embarrassment to catch the COVID, or they want to keep it confidential? Could that also hinder or affect those reporting numbers somehow?
I guess that's possible. I think it depends. There's, again, it seems that how embarrassed somebody is about having COVID, or their willingness to talk about it, it's probably become pretty highly political as well, because one side of the spectrum seems to be wearing the fact that they may have had COVID as a badge, like, see, it is really because I had it. So
right.
And then the other side of the spectrum, if you spend all of your free time on Facebook or Parler or whatever, talking about how COVID's a scam, and then you get it, you're probably not going to go, oh, turns out I got it. So, there may be some of that, but I'm not sure that that's really affecting significantly. The only thing that would really affect the numbers, since it's mandated now that if you have when I say you, the patient doesn't do this, the lab or the physician has to, but you have to report that positive test to a repository, usually in the state. So the numbers that you're seeing on the news, or that you can get from the CDC, or in South Carolina from DHEC, those numbers are accurate. It just depends on whether people that think they're sick might be avoiding testing because they don't want to have to quarantine for 10 to 14 days, or the possible financial sequelae that might come along with that.
But with that as well, I'm kind of curious, because my family's kind of been in healthcare, senior care, and all that for many years, and I'm curious about the HIPAA law when it comes to that, because the HIPAA is a confidentiality, just in case some of you guys don't know exactly what that is. It's about confidentiality of medical issues, and I'm curious about when there seems to be a little gray area in there that you almost mandate somebody to tell someone about your medical condition. Does the HIPAA play any role in this COVID-19 reporting?
Well, sort of yes and no. So what HIPAA protects is, suppose I'm your doctor and you come and tell me something, or I do a test and get a result. HIPAA means that I can't tell anybody besides you or somebody you say that I can tell about that. And then there's some specific exceptions. And those specific exceptions are all administrative. Like, I can put it in the medical record. Your insurance company is going to know because I need that for billing. And then public health is also an exception. So, like, if you come to me and say you've got X, we'll say tuberculosis or something like that, then I have the ability, without violating HIPAA, to contact the health department and say, hey, so-and-so has tuberculosis, because it's important for them to know that. But HIPAA is a protection of disclosure of your personal medical information outside of people who have a need to know of that information. So it could come into play. So, like, for instance, like, say I have a Facebook friend that's ranting constantly about coronavirus being a scam. And then he comes and sees me as a patient, which wouldn't happen because I'm a pediatric cardiologist. But anyways, he comes and sees me as a patient, I test, and it turns out he has COVID. A week later, when I see him ranting about COVID being a scam, I can't go on Facebook and go, dude, you had COVID. It protects you from stuff like that. But as far as reporting into government agencies and to the hospital administration and whatnot, that's HIPAA protected.
Okay. Well, moving right along here is that one of the things that, you kind of alluded to earlier, that we have, kind of 3 or 4 prongs of this thing, if you will. Infections, then you have hospitalizations, then you have deaths. Okay.
Right.
Which one of those should we be watching? Well, we should be watching all of them. I kind of get that answer, but to say that, we're all going to hell in a handbasket. I mean, which one is the most prevalent? I obviously death, but
Right. Yeah. So, but death is a little bit too late. So I think the one that I pay most attention to, if you go to like the Worldometers or some of the other conglomerate sites that take all the information from all the health departments and sort of dump it together and give you the daily count of this number of infections, this number of hospitalizations. And then the one that I watch is the number of serious hospitalizations. So those are people who are requiring support and are probably in an intensive care unit. And those are important because that's obviously the group that's most likely to die. And if you see that number going up and up and up, that's a very bad sign. And that's one of the things that has people so concerned about what's going on currently is a couple of months ago, that number of serious hospitalizations was like a quarter or a fifth of what it is now. It's been a couple of days since I've looked at that, but we had like 25,000 or something like that COVID patients just in the United States in ICUs. And people think there's tons of ICU beds around, but there's not. The number of ICU beds per population is relatively small because when you go to the ICU, generally one of two things happens. Either you get better fast and you're not in the ICU, or you die. So it's typically not you don't typically need a huge number of those beds.
So what basically in essence, what you're saying, it seems like the hospitalizations certainly is an important thing to look out for. The fact that people are getting infected, though, obviously it's an issue, right? Because it's not a normal thing. But the fact that that's going to depend a lot on their health and and all of that, whether they end up in the hospital, correct?
Right. So that's exactly right. So when the numbers started going up a few months ago, and people were saying, well, it's just going up because of testing. Part of that's true. So, like the last couple of days, there's been like 200,000 patients that were tested positive for coronavirus. And that's not cool. It means that the prevalence of the disease throughout the United States community is much higher than it was a couple of months ago. But if none of those patients are getting hospitalized or getting sick enough to need to be hospitalized, then I don't really care if it's 500,000 people because it's not that big of a deal. But as that number goes up, especially if it's in an at-risk population, then you see the hospitalizations go up, and in particular, see the ICU numbers go up. So that's why I watch the ICU numbers, because that gets away from increased testing, showing asymptomatic people, that kind of thing. Because someone who's asymptomatic obviously is not going to show up as a serious hospitalization.
Right. So when you said that there were not that many ICU beds in a hospital. Typically, in a hospital, let's say the size of the one you work with, how many ICU beds would they have?
That's a good question. So in the adult side of the hospital, I'm actually not sure. And there's, of course, far more adult ICU beds than there are pediatric ICU beds, because adults do things like drive cars more often. They have dangerous jobs, so they're more likely to have traumas and things like that. And the older you are, the more likely you are to get sick enough to need an ICU. But I would guess that in the hospital system that I work for, there's probably 20 to 30 medical ICU beds and probably a similar number of surgical ICU beds. And I'll have to look that number up when we get off. And I could be off by a pretty significant margin, but it's less than 1/10 of the number of beds overall.
Yeah. So, but that's a huge thing, though. And I think people need to. This is what I'm trying to talk about, is that real factual information here, right? So when they talk about, you're at 50% capacity, right? You're at 50%. We're at 75% capacity, and you have 25 beds. Only in this case, 25 beds compared to the population. That means that maybe, I'm just going to throw out a number, 10 or 12 of your 25 beds might be full, or you might have someone in them. So that, this is the thing that I'm trying to, and this is a level of frustration that I get sometimes about these percentages and numbers, as though everyone is like, Pythagoras or somebody, the quote unquote father of mathematics, right? And it just absolutely just kind of throws me off a little bit, and probably throws society off when we say, well, most hospitals are almost at capacity with their ICU beds, which might only mean 20. We say that respectfully, but it might only mean that you have 25 or 30 people in the ICU, which is never good. But it's just a reality when you're talking in the millions of people that we have in our society. Does that make sense?
Yeah, and the other thing too is, people think that when COVID was kind of raging in New York City, they set up like the field hospitals and brought the Comfort, the naval ship up there, and things like that. And that's all great that they can put rooms together, a physical space together, but you forget you're not in the hospital because of the room. You're in the hospital because of the nursing staff that's taking care of you. I mean, that's really, if it weren't for nurses, we wouldn't need hospitals. There's nothing that I do in a hospital that I couldn't do for you over the phone at home. It's the nurse that's there watching you and doing the procedures.
Makes sense.
The respiratory therapist and stuff like that. That's the rate limiting factor. So, I mean, we could easily declare every bed in our hospital an ICU bed, but unless you're printing up ICU qualified nurses, it's not going to make any difference in the care of the patient. And that's, I think that's the reason why people are so concerned about the ICUs being full, is that it's it's a limited resource that you cannot easily expand, especially if the need is running out across the country. When they had those field hospitals going up in New York City, the thought process was, well, we'll get a couple of ICU nurses from Greenville, a couple of ICU nurses from Charlotte, some from Texas. And before you know it, you've got, 300 extra ICU nurses and respiratory therapists in New York City, and the places they came from can handle that. And that's great. But now that it's the entire country that's having the problem, there's nowhere to get them from.
Right. Well, I just want to circle back around. The fact of the matter is, though, again, the hospitals only have so many ICU beds. I mean, we're talking 25, 30, whatever, in comparison to the population of the entire hospital, and certainly the population in our country, which would be very small. And all. And so when we see that number, it might be somewhat exacerbating the idea that, that the COVID is just taking over every single aspect of your community. Maybe not completely the case, although it is serious, although we do respect it and we recognize it's something that we have to do something about. Okay, so anyway, I just wanted to, just kind of bring a little bit more light. But I do want to bring up a kind of a crazy point, and this might go a little bit more back to the reporting. What the heck happened to the common cold and the flu? And I ask that with all seriousness, but a little bit of, I guess, sarcasm, because, it's like if somebody gets a sniffle and a cough, you're going to assume today that they have the COVID and not the cold or the flu.
Well, not necessarily. I mean, you might assume that, but so, for instance, like the percent positivity of the nasal swab COVID tests from our testing line in the hospital is up to around 17%, which is fairly high. It's higher than it's been.
Okay.
But that means that 83% of the people who are getting tested are negative. And the only people who are getting tested through that line are people who have cough, sniffles, fever. So that means that 83% of them have a cold, but no one cares about that. Just like, cares is not the right term, but
I get it. Well, that's interesting,
because that means you've got some other coronavirus that's not COVID-19, or you've got a rhinovirus or an adenovirus, or the things that cause the cold forever. And now that we're getting into flu season, we're starting to see people come back. The nasal swab that you do for COVID is basically the exact same procedure you would do to test for the flu. You just have to run a different test on it. So a lot of places are starting to do a respiratory panel that tests for COVID-19, the respiratory pathogens that cause the common cold, and also the flu at the same time. So we're seeing people that are popping up for the flu and stuff like that as well. So they're still out there. It's just that we don't follow them the same way. In the flu season, at least here in South Carolina, is just barely starting. So throughout the winter, you'll start seeing flu numbers come out, because I've heard people say, well, no one's got the flu. Well, yeah, it's because this was through the summer into the fall. You don't expect to see a lot of people having the flu during those periods of times. It's not the flu season. And then all the stuff that we do for coronavirus would also be effective against the flu.
Okay.
So
go ahead.
You would expect, since people are taking steps like wearing a mask, increasing their sanitation, hands and stuff like that, hand hygiene, trying to stay away from large groups of people and stuff like that, you would expect that this flu season is going to be orders of magnitude less than what we've seen in the past when those kind of things haven't been going on.
Right, because we are doing that. Okay, so I'm going to just kind of offshoot this question. I didn't really think about it too much in advance, but you know me, Johnny Davis Live. We'll talk real solutions. So when you mention the word COVID, we're not talking about COVID-19. COVID itself is a virus, right?
No, I mean, COVID is a coronavirus, which is a family of viruses, and
A
COVID
family
is
of viruses.
yeah.
Right.
So there's a causative virus. There's a very specific subset of coronavirus, one particular coronavirus that causes COVID-19. So COVID-19 is the sequelae of having that particular virus. It's the name of the clinical scenario that follows after a coronavirus infection with the 2019 novel coronavirus.
Okay. So if a person has a common cold that they just quote unquote, or the flu, would COVID show up in that test?
No, it would not.
Okay.
The only thing that would make, again, ideally, there's always the possibility
Sure,
of
sure, sure.
blah, 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 blah. But the only thing that would make a coronavirus test, and we use the term, I say we, the population uses the term COVID-19 and coronavirus, the novel coronavirus, interchangeably. But the only thing that would make the test for that novel coronavirus turn positive is if that particular novel coronavirus is present. So I've had patients that have had the respiratory panel done that includes a couple of other types of coronavirus and also COVID-19 that have been negative for the coronavirus, the novel coronavirus or the COVID virus, but positive for one of the garden variety coronaviruses. It looks at a very specific thing about COVID-19.
Oh, that's so good. That is so good, Dr. Lucas. That is exactly what I was trying to, because my mind is crazy, right? I mean, I'm trying to figure this stuff out, but that is exactly what I was trying to figure out. Was there a difference in just COVID and then COVID-19 and all? And you certainly answered that question. Now, the big elephant in the room, everybody's tired of it, right? Wearing a mask or not, right? I want to ask you a question. Here's simple. This is, again, not politics or whatever, but it is political. Should it be mandated that everyone just wears a mask? No, listen.
The reason why I rolled my eyes, I was hoping you're going to phrase that question differently. So I'm going to ask the question that I wanted you to ask. Then I'll answer the question you did ask. So the question I was hoping you're going to ask is, should everybody wear a mask? And the answer to that is yes.
Okay.
I mean, come on, man. It's not that hard. You do it all the time. We sat there for 18 straight hours with masks on at the kickboxing fight. Right. And yeah, sometimes it's a little uncomfortable, but you're not going to die from breathing in your own carbon dioxide. Right. There's no evidence that it increases your chances of getting viral infections because you're collecting some sort of, foul stuff on the outside of the mask. And there's very good evidence that it decreases your risk of shedding virus to other people if you're infected and don't know that you have it. And there was a study that came out recently from the Danish study that a lot of people have been pointing to, saying that masks don't work. And I just want to cover that real quick, just because it's something that's near and dear to my heart. That study actually doesn't show that masks don't work. It actually shows that not only do masks work, but they probably actually protect the person wearing the mask, which I would not have expected, because what they did in that study, at the time, there was very low prevalence of coronavirus in the population that masking study was done in. And what they did is they gave a certain number of people masks and said, wear them. And they wore them, and they saw what percentage of people that were wearing the mask got coronavirus. So that didn't look at, the CDC, Dr. Fauci, and all those people have said, wear a mask because it protects your neighbor. This study was looking at the exact opposite. It was looking to see if the mask protects you. And it didn't reach statistical significance, but there was a fairly clear trend that people that had the mask on had a little bit lower risk of contracting coronavirus. So at best, that study is not useful towards answering, does it reduce the spread? And it may actually show that it's beneficial for the person wearing the mask. So now to answer the question that you did ask, is should masks be mandated? That's 100% a political question from my standpoint. So me personally, I don't think mandating stuff like that helps. No one likes to be told what to do. But I think that if we could go back in time to when the coronavirus was starting, there's a couple of things that I would change, and they both basically involve politicians lying, which seems to come naturally.
Okay, right.
Is breathing air.
Right.
So first, when they first figured out that wearing a mask was probably helpful, there's really good evidence that for a period of time they lied and said don't wear a mask, even though they knew that it would probably reduce the spread, because they were worried that people would hoard masks and healthcare workers couldn't.
And Dr. Fauci actually admitted to that. Yes.
Yep. And they're probably right, because that's the thing that's bothered me most about this pandemic is kind of seeing that American society has some very significant pathologic personalities floating around in it. But I would like to think that if we could go back in time, one of our politicians could have had a sort of a fireside chat and been like, all right, look, this infection that we were hoping was going to stay in China and was hoping going to stay in Italy, it's not. It's spreading. This is bad. It's worse than the flu. It's not the Black Plague. It's probably not going to wipe the population off the earth. But there's a lot of your family members who are sick, senior citizens, whatnot, who are going to die if we don't do something about this. It looks like wearing a mask will help, but we don't have enough masks to go around. So what I need you to do is get yourself a cloth mask, wear a, bandana is not the right term, but that thing, I can't think of the name of it.
Gator mask.
Gator, thank you. Yeah. I might have gotten punched in the head one time too many. Wear a gaiter or something like that until we can get enough of these supplies for the frontline healthcare workers who really need them, because we don't want all the nursing staff and all the doctors to get sick and have a bunch of them die, because that's not going to be good for society. And then once we can ramp up our production, then we'd like all of you Americans, when you go out to the store, when you go to school, when you do this, that, the other thing, wear a mask. It's simple. It presents no danger at all to you. There's almost no medical contraindications to wearing a mask.
Right.
It's not going to harm you, and it greatly reduces the chance that you'll be spreading the infection. And the same thing with hand hygiene and stuff like that. Well, I really think that if we could have done that, it would have avoided the huge fissure that exists now between people who think that masks should be mandated and people who think that they shouldn't. But I mean, you have kids, if you tell your kid, hey, don't do this because I said so, there's a huge portion of kids who are going to do it even though they weren't planning on it, just because it seems, so, and I see that reaction from some people that I know when they say, you have to wear a mask such and such a place. Well, you can't tell me what to do, And ironically, I think the people that are most prone to that knee-jerk reaction of you can't tell me what to do, you're infringing upon my liberty, are the people that would most likely, had you asked them before this happened, would you be willing to make a small sacrifice if you knew it was going to benefit Americans as a whole? They'd say, absolutely. And I can't think of a smaller sacrifice than tossing a mask on.
Right.
So I use the example of, a lot of people, the libertarian bent in particular, a big fan of Rosie the Riveter, back in World War II.
Right.
Tons of women went and did all these hard jobs and made airplanes because the men were off fighting.
Right.
And that's what won the war. Well, these same people that are refusing to wear a mask and are going and yelling at people and, about, I'm not, they're trying to go into stores and there's some person there making minimum wage that's trying to enforce the mask policy in the store, and they're yelling at them from half a foot away and whatnot. That's the same person who would have been, when they said, we need people to build airplanes. You can't tell me what to do.
Right.
And we'd be, speaking German or Japanese, if that were the case, because we wouldn't have won the war. And the United States has done, and I'm not pointing a finger at any particular politician, but I mean, all Americans, you and I included, we're doing a horrible job with this pandemic. I mean, it's really sad to look at the numbers of this country compared to a lot of other countries.
Right. I agree.
And I think that, I always assumed, you always hear Americans pull together when there's something going on. And unfortunately, we have not gotten that to happen yet. And it doesn't look, it's probably too far gone now for that to change. I don't think that fireside chat would work.
No, the vaccine is what people are just waiting on at this point, I believe. But I do kind of
vaccine.
Huh?
And now a lot of those same people are afraid to take in the
right. That which is a whole nother story. But I do kind of, as I listen to you, kind of saying about if you would have maybe did a fireside chat and said, hey, maybe this is a good idea. I don't know if that would have worked, because look at the toilet paper issue, right? I mean, you look at the idea that they thought da-da-da was happening and the toilet paper just left. People don't care about other people. Let's just call it what it is. People don't want to hear this. But unfortunately, we are selfish in this country, and perhaps in other places too. And if you'd have said, hey, to please wear a mask, but there's not enough right now, do you actually think that the rich or the wealthy or whoever can go out and afford and get a mask would not have hoarded them?
Yeah, I mean, there certainly would have been some of that. And again, had I been I guess you'd have to be like the czar of the country. I don't think even being
dictatorship
would
almost
suffice. But there's asking for help, and then there's also steps you can take to make sure that things work. So I probably would have asked Americans to make that sacrifice, and then also confiscated a large portion of the medical supplies that I thought were necessary. And I probably would have also tried to use the Wartime Power Act a lot sooner to try to compel industry. If I would have asked first, and I think we would have gotten compliance, but there's plenty of manufacturing power in the United States to have met the need pretty quickly, and we did. I mean, I was just in the store earlier, and you can buy a mask at the gas station.
Exactly,
all over the place.
Right,
it's no problem getting them. It's just that there was a period of time where they were lacking. Right. So just like in World War II, the government asked for help, and then they also did things like they rationed things that they needed. You could not, if you wanted to build yourself a trailer, you weren't going out and buying steel in 1943. It wasn't going to happen.
Right. Well, listen, I want to remind everyone, you're watching Johnny Davis Live here, and we're speaking with Dr. John Lucas about COVID-19. We will go a little bit over an hour today. I will tell you that. And sorry, Dr. Lucas, I just have so many questions for you.
That's fine. I'm here.
All right. I thank you so much. But, on maybe a lighter subject about the mask, bad breath, right? Some people might not want to wear a mask because they might smell their own breath, and they might have some kind of pulmonary arrhythmia or something going on just before smelling them. I mean, it is a real thing. What does that mean, Doc?
Yeah, I don't know. It's surprisingly hard to smell your own breath. It's kind of like, the guy that stinks when he gets on the elevator and never seems to know that he should take a shower.
Right.
It's the same thing with your breath. Your nose gets it's just like listening to loud music. It gets accustomed to smells very, very quickly. Okay. So it's actually pretty hard to smell your own breath. That's why they always say, if somebody offers you a mint, never say no. Because there's probably a reason why they're doing that. Just because you don't think your breath smells doesn't mean that it doesn't. But yeah, there are lots of conditions that could cause you to have bad breath. Dental issues, people that have diabetes and they're having problems with their blood sugar. There's some other things that can cause that. So if you're having if you're smelling something in your mask that smells bad, you probably should get that looked into and find out what's going on. It could be something as simple as you've got a little gingivitis or, dental issues. You could have a more significant abscess or something like that, but it's something that should be looked into anyways.
Awesome. I'm going to go backwards a little bit here, where we talked about on some other shows about the temperature checks and everything. And I just kind of want to just revisit that just for a moment, because there's still a little bit of confusion in it. But I say that still works because, again, if somebody has a temperature, but I'm trying to get that it would definitely show that they are contagious, I think. And so I'm trying to figure out if the temperature check is that gauge of contagion. Why would you not be everybody doing it?
So a temperature check is not the only gauge of contagion. So it's possibly contagious without having a fever.
Okay.
But what you said is accurate. If you have a fever, you're almost contagious with something, be it coronavirus or some other illness.
Right. Okay.
But it's you're not going to capture everybody that way. So I think for high risk areas, it's a good step. So like if you're having a kickboxing tournament, doing a temperature check at the door is a good idea because it drastically reduces the chance that somebody who's feeling kind of cruddy and actually has a fever but is sort of ignoring it isn't going to come in and infect everybody who's around them. Or like to get into a medical building, a temperature check is probably a good idea for the same reason, because that way you're not going to be sitting in a waiting room or walking through a common area next to one of my patients who's at high risk for getting the coronavirus and give it to them because you've been ignoring your fever. But it's doing mass screenings with temperature checks is not going to, especially in lower risk populations, is not going to do a lot to mitigate the spread, because people, again, younger people, kids, healthy people, are very likely to have coronavirus infection, or excuse me, they're very likely not to have symptoms when they have a coronavirus infection and still be able to spread it. So it can help identify really high risk people for spreading, but it's not going to eliminate the risk of someone that's not having symptoms.
Right, but it does if indeed that. But the question with that again is that level of contagion. So you're saying that even if they don't have a temperature, if they're asymptomatic, they can still spread it.
Correct.
Best you know today, right? And they could spread it just by the droplets, or or something like that, or I mean, how are they going to spread it, especially if they have on a mask?
So the mask is not 100% effective in eliminating your chance of spreading it, because you're still touching stuff. The surgical mask in particular, if you're wearing an N95 mask, you're probably, as long as it has a good seal, which is not a given. It's actually relatively hard to get a good seal with an N95 mask unless you're training how to use it and have been tested. But unless you're wearing that kind of mask, if you're wearing a cloth surgical mask, or even more so if you're wearing or not a cloth surgical mask, if you're wearing a medical surgical mask, or even more so if you're wearing a cloth mask, or especially if you're wearing a gaiter, you're still shedding the virus. But the idea is you're cutting down how much you're shedding. So instead of shedding a ton of it, you're shedding a bit of it. So it reduces the load you're putting out into the community for somebody else to pick up and have to deal with.
Are our hands really that dirty that the fact that we need to wash them all the time and every time? I mean, again, I believe in it. Like I said, I sanitize. We have up the stations. We do it all the time. But I had a situation too where someone who I knew, they have a store, and when the first thing came out, when the COVID came out, it was like washing. Everybody who hit the door, they were doing the squirt of sanitation. They stopped doing it for a while. After a while, they had an infection in the store, right? And so that really works, doesn't it? Just because people are touching a lot of things, hand washing and sanitation. How important is that again?
I mean, it's critical. That's why when you go to the hospital or to a medical office now, you'll see signs all over the place about make sure your healthcare worker sanitizes their hands, because it's been shown time and time and time and time again that the spread of almost every significant infection is from surfaces to the hand to your, touching your face. So the flu does that. That's how you get the common cold. And that's certainly a very common way to get coronavirus. Again, say you have coronavirus and you come and you sit in my workspace, you cough, you spray your droplets, and then 2 minutes later I show up and I grab a pen that you coughed on a minute ago and has your stuff, and I touch the pen and then I touch my face. Now I've just inoculated myself with coronavirus. So sanitizing your hands frequently puts another block in that chain, because if I touch my workspace and pick it up on my hands, and then a second later I sanitize my hands, I don't have to worry about it. And that's why you'll see the germ, this sounds pejorative, but the germ freaks that have traditionally, like whenever they touch a doorknob, they clean their hands, they get colds way less than the average person because they're breaking that transmission cycle. So that's in the hospital. That's one of the things you'll see every time I walk into the room, introduce myself, talk to the patient. And then before I touch them, I sanitize my hands. The last thing I do before I touch the patient. So now it makes it very unlikely that anything I picked up on the doorknob or from the patient I was in before will get transmitted to this person. And then I get done examining them. I leave the room, shut the door. And now that I'm not touching a doorknob anymore, I sanitize my hands again, and anything I might have picked up in that room now stays in that room. And it's been well shown that substantially reduces the transmission of both respiratory pathogens and other potentially troublesome.
So that hand sanitation is huge. It's really huge in washing those hands. Digressing again for a moment, that we kind of alluded to it just a little bit when it comes to testing positive. I want to get more into exactly what that means. And what one should do, because again, we also talk about these antigen testing, and I've been listening to the news lately, and they have them now of like 15 minutes where they can kind of find out whether you are positive or not. But it's not saying that you are negative or positive for sure. I think it just increases the possibility of you being negative or positive, but you have to wait on a more serious type test or something in order for you to be definitely noted as positive. Now, could you kind of explain that a little bit, because it's a little bit confusing and how we need to look at the testing positive and negative.
So testing for this, like testing in general, is very confusing, and we could have a 3 or 4 hour long conversation about this and still not bite it off. But so in general, there's basically for testing for coronavirus, there's testing as evidence that you're acutely actively infected with coronavirus. And then there's the antibody testing, which is the testing that you had coronavirus in the past and you now have antibodies for. So I'm gonna ignore the antibody testing for a second, because that's not really germane to figuring out whether you're sick acutely or not. And the testing that they do, they're looking for evidence that either they can find coronavirus in your nasal pharynx, so they'll do that swab, and then they look for the coronavirus DNA. I think they actually look for the spike protein that's on the outside. You see that mace-looking ball? It has all these spikes off of it. We show a picture of the actual coronavirus. They're testing for those spikes because that's unique to this particular kind of coronavirus, the exact proteins that make those up. So they put your swab into a test called a PCR, where they multiply the types of protein that they're in there to try to grow it to a big enough population they can look for. And then they look to see if they have a spike in the place that would correspond to that. And if they do, they say, well, we see that you have coronavirus in your nasal pharynx, which means you're actively infected with it. And then the antigen testing looks for your body responding to a coronavirus infection. So if you see antigens, that means that your body is probably infected with coronavirus. Now, the actual immunology of which test is better and the percentages and things like that, I'd have to refer you on to one of the infectious disease specialists at the hospital to talk to that at any greater length. Right. The biggest distinction, I think, between the tests that are commonly available is the antibody testing. So if you get an antibody test that's positive, that means that at some point you probably had coronavirus, but it's probably not right now, because you have to have long enough for your body to have produced the antibody. And then there's the antigen testing, or the PCR testing, that tells you whether you might have coronavirus right now. Some of the other controversies are like when you do that PCR and you're amplifying the signals, just like turning the gain up on your CB radio or something like that. If you turn it up too far, you're going to start hearing stuff that's not real. So there's concerns that we may do too many cycles in some countries or some labs, so they have too high of a false positive rate. If you don't do enough cycles, you're going to have too high of a false negative rate. And that's where testing science comes. You have to the experts have to figure out what's the best bang for the buck to be sensitive enough that you're not missing a whole bunch of people who are positive, but not getting so many false positives the test isn't useful.
Right. So when they talk about, after you have been around someone that might have been positive for COVID-19, they talk about that you need to quarantine. And they pick the days of 14 days. Now listen, I'm not trying to be negative or anything, but you were around someone that was positive. So they might have had a mask on, they might not necessarily, made any kind of contact or anything. That doesn't mean they didn't touch anything or whatever. I'm just saying that then they put you on a quarantine for 14 days. I'm assuming what quarantine means, because I've never been on quarantine or in quarantine, that if they say 14 days, you just need to be in your house or around the same environment that you've always been around, I guess, and not around, foreign things. Is that right?
That would be the idea. So the idea behind a quarantine is to isolate yourself from basically any other humans. You don't want to be in close contact with other humans. So a couple of things. One, the CDC just recently, I think it was actually yesterday, decided that 14 days is probably longer than necessary. So they're advocating now 7 to 10.
Okay.
Which, it's only 4 to 6 days shorter, but it's shorter. But the reason for that is that, so like let's suppose that just before, you're going to do a PKB tomorrow, and I'm going to be your doctor. So we hang out tonight talking about it. And then tomorrow you feel terrible, you get tested, and it turns out you have coronavirus. That means that for sure I could have gotten it from you tonight if you and I spent more than 15 minutes within 6 feet of each other. If we had dinner together or something like that, or had one of our normal conversations across the table, then I would meet those criteria.
Right.
Well, for me to get tested tomorrow is not going to be useful because the coronavirus wouldn't have had enough time in my system to be easily detectable. So if you think you have an exposure, getting tested the next day or 2 days later or 3 days later, it's very unlikely to be positive. And then the longer you wait, up to about 10 to 14 days, the sensitivity of that test goes up significantly. So since there's an incubation period for the illness, you can't know whether you're positive or not until some time has passed.
Mm-hmm.
So if you wait 7 days and the person's asymptomatic, so if I get exposed 7 days later, I have no symptoms whatsoever, and I have a negative test, there's I think somewhere between a 1 and 10% chance I may develop an infection in the future. So it's pretty unlikely.
Mm-hmm.
So statistically, it would make sense then to let me go out, because 9 times out of 10, somebody who meets those criteria doesn't present a risk to the population.
Right.
And even if everybody in the population had that happen, that would mean only 10% of the population would be spreading the virus. So it would be fine if that happened.
Right.
If you wait 14 days, or if you wait 10 days, it's something like 1 to 5%. So it's even smaller. And if you wait the 14, it's basically like 1 or 2%.
Okay.
So the longer you wait, the odds get better, but not significantly enough better that it's worth waiting the extra 4 days. And the economic impact is significant. So if you've got 10 nurses that work for you and they all get tested, and they're all going to be out 2 weeks, that's huge.
Yes.
Getting them back after 10 days makes it a lot less likely they're going to overlap with each other.
Right.
So like the school system in South Carolina just moved to 10 days. The hospital is accepting 7 days with a negative test to try to reduce the amount of time that we're inappropriately quarantining people who present no danger to anyone else.
Okay. I have so many questions, but we're going to wind it down here, though. We're starting to wind down. I don't want to make the interview too long and everything. People have to, take a whole 2 hours to almost watch it but I have more questions. But I do want to say, because you've kind of summed up the social distancing, you've kind of summed up the importance of mask wearing and gatherings and things like that. It's all in the conversation and the kind of advice that you gave. So I'm going to move past those questions. And also, Nurse Gurdine the other day put a post up about some of the most dangerous people with this COVID-19 are the people that you know, right? Those people who actually it wasn't that. What was the actual? She said the people that you know are like the most dangerous people or something like that. I can't remember exactly what it was. But I can't seem to find exactly what that was.
Of course.
It's that the danger. What is it? The danger in knowing people and feeling too comfortable, right? Really quick, to sum all of that gathering and social distancing apart, how dangerous is that?
So, I mean, it sort of depends on the individual person.
Mm-hmm.
If you're gathering with a relatively small group of people who are at low risk of serious complications of the coronavirus, and you're taking reasonable precautions, meaning that you're, doing hand sanitation, you're not meeting if you feel sick, have a cough, things like that, the risk to that is relatively low, but not zero.
Right.
So I'd be much more willing to meet with you than I would be one of my father's 74-year-old golfing buddies who has COPD and is on oxygen.
Right.
Because if I were to accidentally give you coronavirus, I would feel bad about that, but that's probably not going to alter your life substantially.
Right.
Where if I give, Jimmy coronavirus, who's 74 and has COPD and is on oxygen, I might kill him. So that kind of, you need to factor in that.
Right. Now I'm going to sum up another thing about vaccines, and we talk about inoculation and all of that. Okay, so really quick, I just want to say something about that. So when I was a kid, right? When I was a kid, I remember having nightmares about going to the nurse, or wherever I was going to clinic or wherever I was going to get my vaccine, and they would have this like gun, right? Right? And it would have like 25 needles. I don't know how many needles it had in it. And they pop you and it hurts really, really bad. And it leaves a scar, I mean, for life. A scar for life. Is this what we're talking about in trying to get those kind of shots?
No. So the immunization for coronavirus is going to be basically very similar to the inoculation you get for the flu. It'll be a little like tuberculin needle shot in your arm. There's actually two. You have to get one, and then a little while later get a second. So it's, I mean, come on, man. We're all fight sports folks. If your biggest concern is the pain of the injection, then maybe fight sports isn't for you. It's not the same as like the smallpox or folks who are in the military and got that pneumatic gun that gives you, like you're talking about, that gives you a bunch of shots together. It's not like that. The biggest concern I think that people have about the coronavirus vaccine is the fact that it's brand new, both the coronavirus vaccine specifically and the class of vaccine it is. It's an mRNA vaccine, which has never been done in the United States before. So it's unique. Most other vaccines either give you a virus that's closely related to the pathogenic virus that you're trying to avoid. So when your body reacts to the vaccine, it will also react to the real thing, or it gives you parts of the actual virus or a killed version of the actual virus. With the mRNA vaccine, you're literally injecting the stuff called messenger RNA that makes your body produce some of the spike proteins that are on the outside of the coronavirus.
Right.
So your body reacts to that. So you're probably going to get a little bit of a low-grade fever, maybe some myalgias for, a couple hours or a day, but you're not going to get sick like you would get with a coronavirus. There's no way you can get the coronavirus from the vaccine. But then when you get exposed to the coronavirus, your immune system was watching for those spike proteins. And as soon as they see it, they'll attack the coronavirus, which will keep you from getting the infection. And what the most important thing about the vaccine is it's been unbelievably effective in all the trials at preventing serious infection.
Okay.
Like the reporting 100% effective. That's hard to believe. But 99.9% effective would, that's astounding.
Right.
So what we don't know is if you get the coronavirus vaccine, can you still potentially harbor coronavirus for a period of time and give it to your friends and family members? Maybe. But if your friends and family members are inoculated against it, then that won't be that big of a deal. I think it's much more likely that we'll learn, but it's going to be a while before we know this, that the injection or the immunization is probably going to not only prevent serious infection, but it's probably also going to drastically reduce person-to-person transmission. And I think we'll see a pretty significant decrease in the incidence of coronavirus once the vaccine becomes widespread.
Wow. I mean, this information has been so solid and everything. I mean, I'm going to wind this down with the final question, and I could talk about the media and who to listen to and who not to listen to and all that kind of stuff. I guess that's just subjective. But I guess my final question would be to Dr. Lucas, that the COVID-19 has really kicked our butts. It has. I mean, it's changed this country. We're going to be very, very different, I think, in a way that we've probably never seen before. How do you think it is going to change our society for the better or the worse?
Unfortunately, I think it remains to be seen whether it changes society for the better or for the worse. Right now, it's not looking too good. It looks like it's for the worse because the fissure that seems to exist between the two political sides is deeper than I can remember it during my 46 years of life.
Right.
But I'm a pretty optimistic guy in general, and I'm still hopeful that we'll see the society or Americans get together and rally to get the economy back up and running once things start opening back up. I think you'll see politicians that were too far extreme on one end or the other will get voted out of office. I think some of the governors that are, basically committing suicide to their economies by locking them down fully are unlikely to come back. Mayors, the same thing. And I think some of the politicians that kind of made it sound like, coronavirus is no big deal, keep on doing what you're doing, they're going to have some stuff to pay as well. And I continue to hope that the middle of America, which is where I think probably 95% of Americans really live, will come together and get the the United States that I, grew up in and love back going and be stronger than we were before this whole thing started.
Right. Boy,
we're in the middle rounds of the fight. I think at the end we'll be better off, but we'll see. I hope so. It's up to us to make sure that happens.
Right. No doubt about it. Well, I tell you, Dr. Lucas, you amazing advice, and I hope that people will take a moment, especially gyms, those in the fight industry, to take some time, sit down, and listen to this interview and pick up some of these ideas of how you can, make your gym safer, make your event safer, whoever you might be. I don't care whether with my organization or not, Dr. Lucas, and you are doing a great job in serving the community as a whole. And I certainly do appreciate you being on today, sir. Thank you so much.
My pleasure.
All right. Ladies and gentlemen, there you heard it right there from Dr. John Lucas. He's our leading fight doctor in this area as well. He's a pediatric cardiologist by trade, but he has a lot of great information. I hope you guys will take some time to really listen to what he had to say. All right, ladies and gentlemen, that's all I have for you today. I want to thank you so much for watching another edition of Johnny Davis Live. Remember, guys, to wear your mask in these difficult times, respect each other, and always forward march. This is a Johnny Davis Live, and I'm checking out. Talk to you soon. Bye-bye.